Okay, so first we're going to assemble all the equipment needed so that it will be easier and accessible to us later. So what we need is a oxygen mask. So I provide here a oxygen mask. If the patient need more oxygen and a concentrated one, so the doctor will prescribe a oxygen mask. So we also have here a cannula. So we also need a cannula. If the patient um, allows to eat but still need a oxygen, so that the doctor will administer a cannula so that it will make more comfortable to the patient to move. So we also need a adhesive tape so that it will help the oxygen delivery device to stay in place. So we also need a padding for the elastic band so that it will not cause pain and irritation into the patient's skin. So we also need a oximeter so that we can check the oxygen level of the patient. So we also need a oxygen tank. This is very important because this will be the one who will provide us the oxygen that we need. So um, after after assemble all the equipment, we need to check the equipment, especially the oxygen tank, if this is functioning well and if there is a oxygen. So to provide immediate care into the patient. So I'm going to introduce myself into the patient. So hi, my name is Cindy Marie Manning. So I will be your nurse for today. Then I'm going to get or verify the patient identity. So I need you, sir. I need you your full name, sir. So the rationale of this is to make your patient more comfortable of you, and the patient will aware of who you are so that it will be easier for you to get your patient cooperation later. Then also verifying your client identity is very important so that you will be ensured that you have the right patient. Then next is I'm going to explain the procedure to the patient, and I'm going to tell him what I'm going to do, why it is necessary, and how the patient can cooperate. So um, this is very important. So the rationale of this is to give knowledge to your patient and to make your patient understand what are you going to do so that she can give her cooperation, and it will be easier for you and for the patient to do the procedure. Then I'm going to perform hand hygiene um, to ensure that there is no any pathogens or any bacteria that can be transmitted into the patient. Then I'm going to provide a client privacy. So in a hospital setting, we have there a curtain. So just close the curtain. Or if we do not have curtain, just close the door and close the window. So the rationale of this is to make your patient um, feel more safety and more comfortable. So um, next is we're going to next I'm going to determine the need for the oxygen therapy. So I need to verify the doctor's order for the therapy. So the rationale of this is to make sure that you have the right patient, you have the right medication, you have the right dose, and you have the right route. So next, I'm going to prepare the client in a semi-Fowler's position. The rationale of this position permit easier chest expansion and can cause easier breathing to the patient. So after that, we're going to set up the oxygen equipment and the humidifier. But also, don't forget to put the no smoking sign in the area where there is a oxygen tank so that we can avoid a um, fire. So now we're going to set up the oxygen equipment and the humidifier. Attach the flow meter into the tank. So if needed, we're going to fill the humidifier with water. Then we're going to put it back to attach the humidifier into the bottle to the base of the flow meter. Then attach the prescribed oxygen device. So let's assume that our patient have a chronic obstructive pulmonary disease or COPD. So it caused the patient to have a difficulty of breathing. So the doctor will administer a oxygen mask to the patient to get the oxygen need by the body. So I'm going to show you how to how to put oxygen mask into the patient. Okay, so first we're going to turn on the turn on the oxygen tank first. Then, attach the oxygen mask. So, here, so I already attached the oxygen mask. Then, I'm going to turn on the oxygen tank in a prescribed rate and ensure the proper functioning. Check the oxygen is flowing freely through the tubing. There should be no kinks in the tubing and the connection should be airtight. You can see bubbles in the humidifier as the oxygen flows through. You should fill the oxygen at the outlet of the mask. Then we're going to set the oxygen at the flow rate ordered by the doctor. So now I'm going to show you how to put the oxygen mask into the patient. So now we're going to guide the mask toward the client face and apply it from the nose downwards. Fit the mask to the contour of the client face and the mask should mold the face so that the very little oxygen escaping to the eyes or around the cheeks and chin will be secured. Then the elastic band around the client heads secure it so that the mask is more comfortable to use. Then pad the band behind the ears and over the bony prominence. So padding will prevent irritation from the mask. So face tent. So place the tent over the client face and then secure the ties around the head like what I did earlier. Then assess the client regularly to inspect regularly to make sure that the device is in the proper position and the patient is getting the oxygen that he needs. Then inspect the equipment regularly to make sure that the patient get enough oxygen that she needs. Especially always check the tank if it have a oxygen and also the humidifier if there is still water. Then now I'm going to take it off. And if the patient can eat or do not need a lot of oxygen, so the doctor will prescribe a cannula. So I'm going to show you how to put a cannula into the patient. So the doctor will prescribe it so that the patient will be more comfortable and easier to eat or drink and function. So now we're going to put the cannula over the client face with the outlet prolong finding into the ears and elastic band around the head. If the cannula will not stay in place, tape it in at the side of the face. So then the pad, the tubing, and the band over the ears, cheekbones as needed. So it look like this. So after this, we're going to do hand hygiene again. To make sure that there is no any bacteria or pathogens that can be transmitted to other patients. Of course, we need to avoid cross-contamination. Then, we're going to do a documentation. So, we need to document everything that we done and what we do. So, the rationale of this is to have a record that will help the medical nurses or the doctors to give a proper treatment plan into the patient. So, that is all for today. Thank you.